Welcome back to our Pink Chat discussion. You'll be asking, what is Pink Chat? It's all about October Breast Cancer Awareness Month. And we SIC ladies and our beautiful doctor here are discussing breast cancer, why you should check what can cause it, your risks and all of that. And of course, the insurance aspect of it for you to be informed and educated and do the right thing. This second episode, we are discussing the prevention, the treatment and diagnosis, right? So we are going to go straight into that. Doc, how can we prevent breast cancer?
Thank you very much. So earlier we outlined some factors that increases your likelihood of developing breast cancer.
Yeah.
So first of all, if you want to prevent breast cancer, you need to modify your lifestyle if you find yourself in the risk factors that were mentioned earlier.
Okay.
And so you need to avoid alcohol consumption. If you can't, then restrict your alcohol consumption.
Okay.
Again, you need to maintain a healthy weight.
Okay.
And you need to modify your diet. It's good to have a more plant-based diet.
Plant-based.
And so yes, so
Vegetarian and
not entirely vegetarian, but it's good to increase the plant content of your diet.
So more veggies and leaves.
Yes,
Less
veggies,
pork.
fruits, whole grains, legumes. Yes,
Okay.
less of the bad fat.
The
that
bad
comes
fat.
from red
Please,
meat.
we want to know what is bad fat.
So it's saturated fats. Okay, these fats can clog your blood vessels. Okay, and usually they come from animal sources.
Oh.
Okay, red meat especially.
Okay. Like the goat meat.
The goat meat,
Cow.
the beef,
Okay.
the pork.
Okay. The pork?
Yes, it's all.
She says the
red.
pork.
It's unfortunately it includes
Ask
pork.
Baba, she says the pork. Okay.
And you should
Dog.
do more of the white meat.
White meat.
Okay.
Okay.
Your legumes, your whole grains. Okay.
So more fish as well.
Yes, and more fish.
Okay.
Yes.
Great.
And poultry.
Okay.
So these are healthy choices that you can make to reduce your likelihood of developing breast cancer.
Okay.
Now, beyond these lifestyle changes, it's important that from the age of 20 upwards, you visit your doctor and discuss a plan for breast cancer evaluation and screening. So usually between the ages of 20 and 40, it's recommended that you carry out a monthly breast self-examination.
Monthly.
Yes.
Oh, self-examination. Okay.
A monthly breast self-examination.
All right.
Between the ages of 20 to 40. But of course, it also depends on if you have other risk factors. Okay. You may be required to do more than just the breast self-examination.
Okay.
Now, beyond the ages of 40 upwards, it's recommended that you have a mammogram at least once a year.
Oh, so my confusion is, why are the younger ages doing self and the 40 plus doing mammogram?
Okay, so it has to do with the prevalence of the disease in young people.
Okay.
That is not to say that young people do not develop breast cancer. In fact, people in their 20s also develop breast cancer.
Yeah, I know someone like that.
Okay.
Yeah.
So that is why you need to see your doctor. He's going to take a history. If he identifies that, in spite of the fact that you're in your 20s, you have risk factors that increases your likelihood of developing cancer.
Okay.
Other screening methods could be recommended for you.
All
But
right.
generally, between the ages of 20 and 40 is the
20 to
breast.
40.
Yes, is the breast self-examination
Right.
that is recommended.
Great.
Now, after 40, that's when the mammogram comes.
That's done in the hospital.
Yes.
Great. So I want to come to the self-examination part. And even before that, I wanted to ask, is it true the ladies with the very big breasts are more prone to breast cancer? Is that, or is just a myth? I mean,
It's one of the myths about breast cancer.
oh really?
It's those who have more dense breasts that are at a higher risk of developing breast cancer. But density is not evaluated by looking at it.
Is it
through No, it's through mammography. That through the mammogram, it can be determined whether your breast is dense or not.
So ladies out there, it's not about how it looks. You might have the big front areas, that doesn't mean your breast is dense. That's what doctor is saying. So if you want to check the density of a breast, you go to the hospital to do that. So doc, straight to the self-examination. We want to know how it's done.
So every woman is encouraged to familiarize themselves with their breast.
Okay.
This is the only way in which you are going to be able to notice a change in your breast. And so it's recommended that you do this monthly.
Okay.
You start by inspecting the breast.
Okay.
You need to stand before a mirror.
All right.
Just look at the breast. Take a good look at your breast.
Okay.
If you notice any change in size, if you notice anything that is different from what you are used to,
Okay.
you need to see your doctor. So after inspection, we move on to the palpation, where you use your hands to feel the breast.
Okay.
We encourage you to lie down on the bed and then use your first 3 fingers.
First 3.
The first 3 fingers. Yes, these ones.
4. Okay. Okay.
The 3 is enough.
Okay.
You can use all, really.
All
you
right.
can use the 4 fingers.
All right.
So when you lie on your back on
Okay.
the bed, you try to, the whole idea is to try and feel every part of the breast.
The breast.
And so in order not to miss some parts, a strategy has been developed that enables you not to miss certain portions.
Okay.
So you rub gently against the breast. You start from the collarbone. You rub gently
All the way here.
across, because yes, there are lymph nodes that, if you have breast cancer and the lymph nodes are affected, you could palpate some kind of a swelling here.
Okay.
So it's good to start just above the collarbone, feel the area, and then move downwards vertically to the bottom part of the breast.
Okay.
And then go horizontally.
Okay.
And then you do a diagonal
Hey.
palpation as well.
Up, down.
So vertically,
Okay.
horizontally,
Okay.
you do diagonally
Diagonal.
this way.
Interesting. Do you have to
And
do it
then-
yourself, or you can have someone do it for you?
Well, if your husband or your spouse
Okay.
is trained in it,
Trained.
yeah,
They
just
need
the training that
The one you are
given,
giving
yes,
us. Okay, so
yes.
the men, you should pay attention to this as
Yes,
well.
if your spouse
Okay.
is trained, he can also
He can-
assist you do it.
All right.
And then after the palpation, you squeeze the nipple between 2 fingers to see if there's any discharge.
How much squeezing are you talking about here? Because to see discharge, you really have to squeeze.
Not really. It should be gentle. You don't want to injure yourself
Okay.
at the end of it, but
Okay.
you should be reasonable enough.
All right.
A
So
reasonable
just to
squeeze,
test if
a
there is
reason-
discharge
Yes.
in there. Okay. All right. I hope ladies will be able to do that tonight or tomorrow morning. Your husbands, you teach them first so they don't hurt you, so they can do it for you.
And there are many resources on the internet that
Okay.
actually demonstrate
Straight
how
it's done. So you
And
can go on
If
YouTube.
it's not clear, you could.
Okay.
Yes.
Great. Thank you so much, doctor. We would be going to the diagnosis and the treatment. But before that, a common question that came up was, I have a life insurance already. I'm already signed on to a life insurance. Why would I take a home plus? Madam, can you answer this question for us?
Yes, initially when we were talking about the Home Plus policy, I had explained that because SIC had the customer in mind as a family,
Okay.
we are looking at a holistic picture of
Alright.
home. So then, whilst you already have the life,
Mhm.
what happens to the building? What
Mhm.
happens to the contents? What's happening to your home assets?
Okay.
So then, if you have the life, then you can take the
Home plus.
Home Plus also, where it will take care of your buildings and your other belongings too as well.
Okay. And more importantly, the critical illness
And
bit.
the critical illness to be that
Okay.
one too. it will also help.
Okay,
That,
great.
that is
Phyllis,
the
if I can,
Mhm.
with the home plus, for life insurance,
Okay.
you don't have critical illness attached
Attached
to
to
your
it.
life
Please speak up
insurance.
louder for us, because what you're saying
The,
is very.
the life insurance does not have that critical illness
Okay.
aspect, and that is why SIC is offering up to 50,000
Wow.
care.
Up to
Up to
50,000 K.
50,000 Ghana.
Okay,
Yes.
great.
Care treatments
Okay,
for you.
great.
That is why you
You
should
should
the
take
Home
this one. So
Plus
so
policy.
it's not just life, neither is it just the general. It's a hybrid.
Yes.
So if you're a lady out there and you're listening, it's October, it's breast cancer month. We want to draw your attention to Home Plus as well, because if you have this insurance package, it takes care of you if in case you are down with breast cancer. And as Muriel said, you get 50,000 medical care in case of such issues. Now, Doc, let's move straight to the diagnosis and the treatment. Some people might have been going through this. You might have been diagnosed of breast cancer. And first of all, we don't want just the medical side. We want to talk about the psychological side, because for me, cancer is very scary. So if someone out there has been diagnosed of breast cancer, what I mean, talk to us, Doc. Both
Okay.
psychological, both and the medical as well.
Right. So I'll begin with the diagnosis.
Great.
And then I'll speak about how it is
How
managed.
it's all right.
So for cancer to be diagnosed, it has to be done clinically.
Okay.
Not every breast lump is cancerous. So when you find a breast lump or you do a mammogram,
Mhm.
which indicates that there could be breast cancer,
Okay.
when you present to the hospital, we do a biopsy of the lump. Now, a biopsy is taking a sample from the lump
Mhm.
and testing it and examining it under a microscope.
Okay.
So only after that can we definitively say that you
Yeah.
have cancer.
Okay.
So until then, we can only suspect
Can only
that
suspect.
it's
Okay.
cancerous, but it's after the biopsy results
Mhm.
that we
Can
can
be sure.
conclude that
Okay.
what you have is cancer.
Okay.
Now, the management of cancer
Mhm.
is a team effort.
It's
Okay,
a team effort.
It's a team effort.
Tell us about that.
Now, there's a medical team
Okay.
that handles the various aspects
Mhm.
of the diagnosis,
Okay.
because we know that it's quite a huge
Yeah, it's a huge
news
blow. Yeah.
to unfortunately
Mm.
receive. And so there's a medical team, okay, that handles the surgery.
Okay.
There's a clinical psychologist
Okay.
that's part of the team.
Okay.
And then your family as well.
Family.
So usually you meet with your main care provider, who outlines the various modalities of treatment that you would require. And yes, you need your family support, because as we agreed,
I mean,
it's
you
quite a
you don't
huge
don't
blow.
sleep at the hospital. So when you are done with the hospital, you come home, and that is where you need a family. That's what I'm saying.
Precisely. They need to know how to support you
Support.
as you go through the treatment.
Okay.
Okay. And the treatment modalities, the medical ones, are mainly surgery.
Okay.
Okay. And now, depending on the type of cancer that was found and the stage at which it was found, the lump can just be removed.
Oh.
In other cases, the entire breast has to be removed.
Wow.
And there are cases where the lymph nodes that supply the breast, and majority of them are in the armpit and in the middle part of your
Middle
chest.
area.
And
Okay.
so the lymph nodes may also be removed.
Wow.
And in other cases, both breasts can be removed.
Wow.
And so you can appreciate how traumatic this is
very traumatic.
for the patients,
Very
and why they need the support of counselors.
and all this is expensive.
Precisely.
It's
yes.
expensive. So let's not take this insurance bit for granted, honestly, because if you are having 50,000 CDs to support, it goes a long way. Now, I want to come back to our ladies, talking about this traumatic experience. There are some ladies out there who are watching us who might have had both breasts taken out, and it affects your lifestyle. It affects family, work, and all of that. What do you have to say about this?
Listening to doctor gives me the impression that it's not easy out there. So for those who had been able to survive, we thank God and we want to tell them that they rock.
You rock, ladies.
And for those that are still in it, we want to tell them that we are with them. They should still keep on being brave.
Great.
Because if others have been able to conquer it, we know that they would also get
Great.
there. And
Great.
also with the help of Home Plus, we
Thank
can
you.
take some of the financial
Thank
burden
you.
from them too
Great.
as well. And they will get there. We really appreciate and understand what they are going through.
Yeah.
But the thing that we also want to tell them is that we can help them with the money, we can help them with advices, but the will to live comes from them.
Make it a point to survive this for us. Auntie Muriel, say something to our ladies out there who might have gone through this and have survived, and some who are still in the process.
Thank you. Cancer definitely is not a good news to hear.
Yeah.
And most especially to the women that need the breast to rub their dresses
Yeah.
and all that. So
Yeah.
you can imagine if you are told your breasts would be removed. It's a shocker.
Yeah.
But I would want to encourage all the women out there. Removing the breast is not the end of life. You have artificial
Yeah.
prosthetic.
In fact, those some of us who
Yes.
have breast still borrow the artificial
Yes, we still
to
do
rock
borrow.
better.
And I always say this. I mean, what is the use of a dying breast? If you keep it, you still die.
Exactly.
So why don't you take the breast off?
Yes.
Have your life.
Yes.
You have time with your family.
Yes.
At least you are assured of some more 10 years if you're able to take it off.
Definitely.
And
Definitely.
some have lived beyond the 10 years I'm talking about.
Great.
So be encouraged. I mean,
It's not the end of the world.
Yes. All is not lost.
Yes.
All
yes.
is not lost. Some people walk into the hospital to willingly take it off
Wow.
because they've had hereditary traces.
Great.
So you can also go over beyond the soul cancer
Yeah.
mindset,
Yeah.
so-called cancer mindset.
Cancer is not
And
the end of
yes, it's not the end of it all.
Thank you.
And move on with your life.
Thank you so much, Doc. I would like you to conclude for us. We're getting to the end of this beautiful discussion, and we are taking the concluding message from everyone. Doc, advise us. Yes.
All right. So I'd like to support Muriel in encouraging ladies to avail themselves to the treatment options available. The peculiarity of breast cancer in Ghana is that people delay in presenting themselves to the facility. And so they present themselves in the advanced stage, and the options available to them are limited. So I'd like to encourage ladies out there to take the advice that we have given. Do the monthly breast self-examination. If you notice any abnormality, make an appointment with your doctor and follow through with the advice that is given. Finally, it's important that we recognize that it's the clinical treatment that has been proven to improve survival. People, after the diagnosis has even been made, resort to various methods that are unsuccessful, such as the prayer calms, all manner of expensive natural herbs, and they believe that these forms of treatment are effective.
They are even dangerous sometimes.
But in the end, they discover it's not effective and they present in the late stage. So please visit the hospital when you discover any abnormality in your breast, and we'll take care of you.
Thank you so much, Doc. Head Marketing, let us know your final words and how to get on this Home Plus, because now I think all our interest is in getting the Home Plus insurance.
Yeah. Okay, so with the Home Plus, we will first talk about the traditional method. That is where you can walk to any of our offices nationwide.
Great.
And then you can take the policy there, or you can use our social media handles, which is being displayed on the screen as we are speaking, or you can call any of our numbers,
As well.
which are also being displayed on the screen as we are talking, to take the policy. This is a fantastic policy that I would encourage every home to take it, because it has so many benefits that gives the ease of mind when you take this policy. And I also, since this is the breast cancer month, and I'd encourage both all the women and the men as well, let's just walk into any hospital to try as much as possible to see if we can check to see if there's any symptoms, because as they say, prevention is better than cure. And then for the survivors, stands up. For those in it, we know you are going to survive, all things being equal. God on our side.
Thank you so much, Head Marketing. President of SIC, your last words for us?
To all the ladies out there, especially my ladies in SIC, from next week, we are going to organize screening exercises, please.
Wonderful news!
Yes, please make sure you get examined.
Great.
And try and involve the men as well.
Yeah.
They have been touching those breasts, so they should avail themselves to touching. Yes, you also touch this.
Thank you so much. Thank you so much. It's been a wonderful discussion. We've had it from all angles. And for me, the most important thing, don't wait till it happens before you get protected. Protect yourself now with the SIC Home Plus. In case this hits you, you know that you can be buffered in a way and you'll be fine. Thank you so much, amazing ladies here. We hope to catch you some other time. And as Auntie Muriel said, get those breasts checked. See you and bye.
Bye.